The area being assessed here is the knee, and a safe setup for the knee is to ensure that the positioning of the patient is comfortable and when lying down in supine position, which is on their back, as well as prone position, which is on their belly. When doing resisted movement, the practitioner needs to make sure that they are pushing against the leg in the opposite direction, as this will make them more stable. For example, when doing extension, they stand at the edge of the bed. They also need to ensure that the bed is adjusted to the correct height so that the practitioner isn't bending over, which could cause back pain. Movement in the knee. There is flexion, extension, and medial and lateral rotation. So active flexion is where they bend the knee and bring the heel towards the bum as far as they can go. Passive flexion. Make sure the client is relaxed as possible, for example by making them breathe in and out, and once they are relaxed, now take the weight of the leg and bring them into flexion by placing one hand on the bottom of the leg and the other hand above the knee, and move the leg and heel towards the client. Resisted flexion. This is an isotonic contraction, and this is where the client is brought from a lengthened position to a shortened position and contracted the whole way through. For this, the client will be lay on their stomach, and the practitioner will place their hands on the back of the foot and push the foot down, whilst the client is resisting and trying to bring the leg up towards their glutes from extension. Active extension. Client starts in the flex position with heel towards the bum, but this time they are going to extend and straighten the leg and push the knee into the couch. Passive extension. Once the leg is in flexion, the practitioner now needs to straighten the leg and bring it back down to the couch. Whilst doing both flexion and extension, the practitioner needs to look at the face of the client to see any signs of them being in pain, for example, any squinting of the eyes. Resisted knee extension. The client needs to place their leg into flex position so their heel is towards their glutes whilst laying on their stomach, which is also known as prone position. The practitioner needs to place one hand at the bottom of the flex leg whilst the other hand is placed on the pelvis of the client. The practitioner is going to push against the client by pushing downwards whilst the client is pushing their foot away from their body until the leg is straightened and fully extended. Active internal rotation. This is where the practitioner will give a command to the client, for example, bring their toes inwards towards each other. Passive internal rotation. The practitioner will take the weight of the foot of the client and move the toes inwards towards each other. Resisted internal rotation. The practitioner must place one hand on the tibia to help stabilize, whilst the other hand is at the top part of the foot, and the client needs to push and resist against the practitioner's hand to move the foot inwards. Active external rotation. The client brings the toes away from the other foot. Passive external rotation. The practitioner will place one hand on the heel and base of the foot and the other hand on the knee, and then try to relax the client. And this can be done by getting the patient to take a deep breath in and out. Once they are relaxed, the practitioner will then move the foot away from the other foot. Resisted external rotation. The position of the hands are placed at the tibia and the hand is placed at the inwards part of the foot, and the client needs to resist against the practitioner who is trying to push the foot inwards, and the client is trying to move the foot away from the other foot and outwards. And the functional test for the knee is a squat. The muscles being examined when doing flexion are the hamstrings, in particular the bicep femoris, semitendinosus and semimembranosus, and the muscles that are being used for extension are the muscles in the quads, for example, the rectus femoris, vastus lateralis, vastus medialis and vastus intermedius.